Hi, my name is Danielle Howell. My informative speech will be on hypothyroidism. Hypothyroidism is a condition that causes complex illness that wants the person's body. Hypothyroidism is most common between the ages of 20 through 40, but it can occur anytime. This autoimmune illness caused to unattended weight loss, despite of increase in appetite or irregular or increase of heart rate as known as tachycardia, which also leads to insomnia, anxiety, and mood swings. If left untreated, hypothyroidism can cause many other deliberate illness. For example, it can cause an irregular heartbeat, increase in heartbeat, which will lead to blood clots, stroke, or even heart failure. In most cases, hypothyroidism is caused in life-threatening disease that mainly goes unnoticed. Last year, my aunt was diagnosed with hypothyroidism. Months prior to her diagnosis, she complained about it and led to carrying a battery powered fan with her. Due to her age, she was just assumed that it was menopausal, but her doctor told her that the older women who experience hypothyroidism, the symptoms can resume menopausal. After a few tests, she figured out that she had hypothyroidism. Hypothyroidism is most common in women. However, if you have a family history of thyroid disease, high amount of iodine in your bloodstream, or use of nicotine, it can increase your chances of having hypothyroidism. The most common cause is Graves' disease. It is an autoimmune disorder which is immune system attacks the thyroid gland and causes it to produce too much thyroxine. It is an overflow of thyroid hormone can cause the body metabolism process to speed up, which is why it can also make type 1 diabetes difficult to manage. Another cause of hypothyroidism is high amount of iodine. Iodine is a common food such as seafood and its baked potatoes. Since the thyroid gland is use of iodine to make both thyroid hormones, high amount of iodine can cause a huge increase of hormones to be made. According to the U.S. Department of Health and Human Service, in 2021, there was at least 3 ways that treat hypothyroidism. Those options are medication, radioactive iodine therapy, and thyroid surgery, the removal of thyroid. Beta blockers can help diminish symptoms, which a more permanent treatment type is found. However, they would not stop the thyroid production. Specific anti-thyroid medication may slow the production of the thyroid hormone and make Graves' disease simply temporary pause. However, anti-thyroid medication causes with many side effects. The course of the treatment can range from 1 to 2 years and is not a permanent solution. Another option would be radioactive therapy. Due to the cells of the thyroid glands are slower destroyed. This process does not affect other organs. Also, people who undergo radioactive iodine therapy have a high risk of developing hypothyroidism. underactive thyroid glands, but according to the article, it's easily treated and managed. Finally, the last invasive form of treatment is partial removal of the thyroid glands. This is called thyroid hormone levels to settle back down, but because of the anesthesia used, one may experience a temporary worsening of symptoms. Thyroidism is a common life threatening disease, however, it mainly goes unnoticed. Symptoms of the disease can lead to heart, menstrual, and fertility cycles and can worsen your anxiety. It is important to recognize these symptoms because left untreated, hypothyroidism can cause stroke, insomnia. It is important to remember that conditions can be caused by grave disease, iodine rich diet, and nicotine. There are many treatments, each of variable the degree of efficiency, which must be weighed between you and your physician. However, the first step is actually recognize these symptoms before the treatment has chance to worsen. Thank you.